So Heather, what do you tell your patients about the causes of their asthma?
We recognize that asthma isn't just one disease. The causes can be very, very different for different people. But we do know that genetics is important. If you have one parent who has had asthma, you'll have about a 1 in 3 chance of having asthma yourself. But if you had both parents with asthma, your risk of asthma goes up to well over 50%. For children who are first developing asthma, it could be an early viral illness that could trigger the inflammation leading to years of asthma, or allergy can play an important role. Especially in child asthma, we see that most of the disease is allergic asthma, and we see that for an important percentage of adults as well, though it's not as high as in children. In this age of personalized medicine, we're recognizing more and more that it's important to understand what's underlying an individual's person's asthma, because then there are potentially treatments coming down the pipeline to target that specific type of disease.
You know, in my adult patients, I also need to be concerned about occupational asthma. There are occupations or exposures that can lead to asthma, and so that I always like to take a very good history of what they do, not just at work, but even in terms of hobbies, and really assess those exposures. Of course, the allergic asthma can carry over into adults, and I see a component of that. But I also see a fairly significant proportion of asthma which is not due to allergies in adults, and that's interesting because then I have to tell the patient that I really don't know what's triggering or causing it. We work very hard together in trying to identify causes or triggers of their asthma, but many a time we are unable to. The good thing is the treatments still work with those individuals.